من زملائنا. Today my talk is going to be about a recent infection happening all over the world. This is monkeypox infection. What's monkeypox infection? It's a viral disease, usually occurs in animal, but it has been transmitted to humans, and now it is spreading between humans. Okay. As other viral infections, usually it is characterized by the following features: fever, swelling lymph nodes, rash. And the rash is composed of papules, vesicles, blisters, and pustules. The disease is caused by monkeypox virus, which is a zoonotic, i.e. from animals, in the genus of orthopox virus. So it's a type of pox viruses. The first outbreak of this disease happened in 1958. There were two outbreaks of the disease happened at that time. It started in animals, which was transmitted to humans, either by direct contact or by rodents. And since then, it was spreading between humans. There are two types or clades of the mpox viruses. One is originated in Central Africa and one in West Africa. The current world outbreak in 2022, everybody heard of, is caused by the less severe West Africa clade. What is the difference between the two? The mortality rate in the Central Africa trade is much higher than the West Africa trade. On July 22, 2022, the WHO declared the outbreak of a public health emergency of international concern called PHEIC, يعني between brackets ديروا بالكم, with more than 53,000 reported cases. I experienced two outbreaks of viral disease which I didn't recognize or didn't diagnose before. One in 1995, as I remember, in the mid-90s, in the middle of the embargo, we had an outbreak of German measles. We're supposed to be free of German measles of the vaccination, but so many cases came to my clinic. They were suffering from mild erythema. There were young adults and children, and then at the beginning I thought this is just toxic erythema or viral exanthem, but after thorough investigations I found that these are German measles cases, and I told my colleagues to be aware of that outbreak. The other disease which I didn't see, when I went to the United Arab Emirates, I saw so many cases of multiple papules and vesicles, mainly affecting the hands and the feet and the mouth. They resemble chickenpox. Initially, I didn't make the accurate diagnosis, but then the diagnosis was hand, foot, mouth disease. And it is endemic. We see every week 1 or 2 cases of this disease. In my clinic, it was exactly on the 14th of June of 2022. This patient came to me, and he was suffering from these lesions on the genitalia. They look like, I call them annular papule, a slightly raised edge with depressed center, and the center is darker than the periphery. And this lesion is very pathognomonic. It looks like primary chancre of syphilis, but when you palpate, it is soft. And usually the patient is suffering from many of these lesions. So in the beginning, I was really confused. I haven't seen such a case. But I assumed this is a viral infection, but which viral infection, I didn't know. The patient was febrile. I examined the lymph nodes. The lymph nodes were enlarged. I did all the serological tests necessary. They were all negative. So I gave him just symptomatic treatment and let him go, and to be followed later. After 2 hours, the same day, this patient came to me. So I said, must be something different of what I know. And if you look at the lesions, they are all the same. These are the annular papules we talked about. Depressed center, which is darker, and raised edge, and surrounding the genitalia. But this patient was more severe because he had fever, and the rash was spreading all over the body. Both these patients were married, but they had illegal sexual intercourse with another lady. So both were heterosexuals. I did histopathology for this case, and it was non-specific, just inflammation. The third case, these are the lesions elsewhere. This is the same patient. The third case was 20 years old male. He came on the 13th of August 2022. You can see the typical lesions, but surrounded by erythema. Sometimes the lesions are surrounded by an area of erythema. So I looked in the literature, in the Google, just to give me a clue. Fortunately, I found a picture of monkeypox, different lesions showing the same, this pathognomonic lesion. So I thought this is monkeypox definitely. So what I did, I called the primary health care center and told them about the case. They said, send the patient to me. The patient went to them. They did a swab and they did PCR, and it was positive. Positive cases usually are admitted to hospital, and he was given antiviral treatment. So this is a typical case of monkeypox. Within 2 weeks, I saw 3 cases. And this is the 4th case. This picture is not mine. One of my colleagues, he's a urologist, he called me, he said, I have a patient with such a lesion. So I told him, please send me the picture, and he sent the pictures on the WhatsApp. So immediately I told him, send him, this is monkeypox. And he was surprised because nobody have seen any monkeypox in the genitalia before, at least in the UAE. And it was monkeypox, which was confirmed by PCR and also referred to the hospital. This is the 4th case. This is a lady, 52 years old. She came on the 2nd of January 2023. She had a rash around the genitalia, which is typical of monkeypox. These pathognomonic papules surrounded by erythema. She was febrile, and also she has lesions elsewhere. She has now a blister on the nose and lesions on the arms and legs. So I sent her, and I examined, fortunately enough, I examined her husband. He didn't have anything. Probably he was a carrier, I don't know. I sent the patient to the primary healthcare center, and they did the necessary things to her. This is the 5th case. Just came to me a week ago while I'm doing the slides for this meeting. He has a lesion which is not typical of monkeypox, but you can see a depressed papule. Why this is not typical? Because this is a late lesion. The lesion started 2 weeks ago, so it is in the healing stage. But he was febrile when I saw him, and he has lesions elsewhere. See, there is one lesion on the finger, one lesion on the arm, one lesion on the trunk, and I sent him to the primary health care center, and they dealt with him as usual. My message to you, whenever you see such a lesion, put in your mind monkeypox. Now it is spreading. The most important thing about monkeypox, it can kill you because the mortality rate in monkeypox reaches sometimes up to 10%. So the early diagnosis, the early treatment, and also the prevention from monkeypox, education of the public is very important. So put this in mind. These are the commonest types of STDs we see in our clinics: urethritis, gonococcal and non-gonococcal. Syphilis rarely we see. Human papillomavirus we see a lot. Trichomoniasis, mainly the gynecologists, they see it. Hepatitis B, sometimes we see it. HIV, chlamydia, herpes simplex, mollusca, pubic lice, and I put at the end Mpox. So Mpox now is becoming an STD. There is a controversy about that. If you see this paper here, monkeypox is not a sexually transmitted disease, a public health concern and avoidance of myths. This paper suggests that it is not an STD. While there's another paper contradicts this paper, current evidence demonstrates that monkeypox is a sexually transmitted infection. So there are two groups of groups of authors. Some of them consider monkeypox as an STD, others they don't consider it as STD. In my clinical practice, I see monkeypox only in the genitalia and transmitted from one person to another by sexual intercourse. So I consider it as an STD. This latest report from the University of Minnesota, there is a commentary: no question, monkeypox is an STI. So now monkeypox is definitely an STD. So my message to you, be aware of monkeypox and educate the doctors and educate the public. And thank you very much for listening to me.